Unstructured data, structured data, big data, analytics, predictive analytics, prescriptive analytics, yikes! Now comes interoperability. According to the Healthcare Information and Management Systems Society, that's the ability to exchange data and subsequently present that information in such a way that it can be understood by the user. Greetings, everyone, and welcome from the Technology Association of Georgia. It's July 28, 2015, and this is Tech Talk. I'm your host, Frank Baia. Interoperability in healthcare is the ability of different information technology systems and software applications to communicate and exchange data and to use that information that has been exchanged. The benefits are clearly obvious. Ultimately, data shared across clinicians, labs, hospitals, pharmacies, and the patient, regardless of the application or the application vendor. The ability of health information systems to work together within and across organizational boundaries in order to advance the effective delivery of healthcare for individuals and communities. The Tech Talk focus is on interoperability service in healthcare today and in the future, as we speak with Scott Fannin, VP of Interoperability Services, and Rob Newman, VP of Product Management Interoperability at Greenway Health. It's a Tech Talk in-depth look at the evolution of information today, from big data to analytics to interoperability, and the initiatives already delivering results in advanced data liquidity across the entire care system to improve care coordination and care outcomes. Up to the Tech Talk, Greenway Health VPs Scott Fannin and Rob Newman. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Scott, Rob, welcome to Tech Talk.
Hello, Frank.
One of the interesting things I think we're going to focus on today is interoperability, which obviously is the key to the discussion today. I think for our listening audience, and a lot of our technology people are pretty much aware of the tsunami, if you will, that's happened in disruptive technologies across every vertical, but certainly in the health IT space, so many changes have been happening so quick and more to come. I was talking to someone just the other day that was saying we don't know where it's going or when, but we know it's moving forward. Scott, let's start with you, I guess, maybe for our listening audience, many of which probably are somewhat familiar with interoperability, I can say that. But why don't you give us your perspective on it?
Sure, Frank. So interoperability is really all about how we transmit data between different systems, software systems, applications, and how that data is communicated across the wire and how it's consumed on the other side. So it really is all about how we can take two different systems and exchange data in a meaningful way and allow those systems and the people that are using those systems to use that data.
Now, am I correct in saying it combines both information technology and software?
That's correct, and also communication methodologies as well. So it really it's about the ability to send over the wire, of course, securely, and the ability to consume the data once it arrives in a way that really can help the consumer of that data.
Well, and I'm sure that right now it's an extreme convenience, but in the future it's going to be literally the backbone as far as, I guess the question would be, what does it matter to healthcare? But fundamentally, if we look ahead and say what's it going to be like just in a few years, it would seem like it'll be the infrastructure for what healthcare is all about. Tell us a little bit about that from your perspective. Again, Scott, does it matter to healthcare now, and how does it matter in the future?
Absolutely, it's critical for healthcare. It has been critical for healthcare for quite a while. We've been doing interoperability for many years, and really it's all about how can we exchange this data in a way that's going to help serve the patient. We need interoperability in healthcare because different systems record different types of data about patients, and that information needs to be transmitted to other providers, to the patients themselves, to other care settings. So the systems have to be able to communicate and transmit the data in a way that's meaningful to render the care. And what we're seeing as time goes on, more and more the care is being rendered not just in the office, but in many different care settings, whether it be the home, the hospital, wherever else that patient may receive care. It's important that their information can be transmitted there and consumed by those care providers in that environment.
Well, when we talk about wearable tech, when we talk about some of the, as you point out, mobile devices that'll be more at home or as much at home, even communications like Skype and some of the imaging for virtual visits. I saw a package the other day on television that was talking about distant surgery using robotics and the ability for a doctor to be in literally one country and operate on a patient in a completely another operating facility in another country. We're not there quite yet, I would guess, but isn't this more or less the evolution of the infrastructure that you're building out? I mean, the ultimate promise is kind of an internet of all things for healthcare.
Yeah, and this is Rob. Absolutely, Frank. You have to have the right data available at the right time for this to be usable. So it's key to have information there at the point of care when the physicians need it.
And again, the challenge is, I'm sure, is early adoption and probably even some of the transition from format to format. And I'm guessing now, looking at it as I often say when we have conversations with so many different verticals on Tech Talk that I come as a tourist because there's no way to keep on top of every single thing and without any question, and to definitely get to the point where it's you get granular about it. But maybe either Scott or Rob, if you want to field this one, we can obviously expound on the possibilities of the great things that it can do. Challenges off the top of your mind? Do we seeing any challenges as far as the healthcare industry is concerned as far as interoperability?
Yeah, many challenges on several fronts there. Some of them that we face are just location or finding the data. Sometimes you don't know where the data needs to be sent. You don't know who the ultimate recipient is. It just needs to be with the next physician. So in kind of contrast to that, sometimes you don't know how to locate data if you're a doctor on working on a patient. You want to know what other doctors have diagnosed this patient with. You want to know what types of medications they're on, things like that. So finding that information is tough. Once you find it, sometimes it's in narrative form that can't really be interpreted by a computer. Really what we're wanting to get to in the future is to be able to have computers read the information, understand what is there, put it together with information that I as a doctor would put in my system and work with those together. The lack of discrete data currently in our world is a challenge to us.
Security and protocol and that kind of thing, is that what we're saying?
Absolutely. Privacy and security are large, really issues that we hit on a day-to-day basis. Sometimes patients don't want their data shared. Lots of times you run into just types of data that people don't really want other doctors to know about, just their doctor that they're talking with. One of the things that we're also seeing in the industry is really just a shortage of knowledgeable resources in Interop. So another big challenge we have.
Now, once again, just to continue to explore this thing from a tourist perspective, again, jokingly speaking, but obviously self-directed healthcare, some of this information will be managed and controlled as much maybe early stage by the facilities, the medical facilities, the doctors themselves, but I'm guessing that sooner or later there's at least an interoperability, if you will, even with the patient being able to access and control that data and information in some way?
Absolutely. With the consumer becoming much more of a active participant in their health, you're seeing a lot of patient portals, a lot of consumer devices, and a lot of consumer involvement, and so that data needs to be made available for the consumers as well to help them take better care of themselves when they're not in the office or seeing the provider. So getting the data to them and being able to get input and information from them is becoming more and more important. With reimbursements going down, the patient is picking up more of the financial load, so they are demanding a bigger stake in the information and how they're being treated and what it's going to cost them. So that consumerism is a real big a real big trend that we're seeing, and interoperability is key because a lot of those solutions are totally different solutions, and so the need to have some the semantics and the vocabulary enough stabilized so that two systems can talk is critical. Like Rob mentioned, the lack of discrete information has been a real challenge, and we kind of take it for granted. But to give you a simple example, everybody knows what address means or city means as a field. When you start to say things like, okay, if you've got penicillin, if you hear the word penicillin, does that mean it's an allergy? Does that mean you were given penicillin? What does that mean? So the context, a lot of times, is where we stumble with interoperability, because that semantics and the complex vocabulary really adds an additional challenge.
Well, it's like any technology, though. It's an adoption of the culture, right? I mean, because really what you're describing is just not just, I mean, I'm oversimplifying it, but the reality of it is they're not medical professionals, and somehow or another you're going to have some evolution, address some form of user-friendly understanding of just the problem that you're posing. And I apologize, Scott. I think it was Rob that was commenting on what I'm calling the culture of that communication and that relationship in a self-directed patient standpoint. I mean, obviously Greenway is already evolving into such a multi-talented, multifaceted technology resource that at some point I'm guessing it becomes almost like I'm going to oversimplify again, but almost like a cable broadcast channel, in which the access has to be so user-friendly that it's actually entertaining as much as it is educational or disciplinary, so that it isn't like a DOS setup where you're dealing with hard programming, or it's a user interface that makes the situation relatively simple and easy to use.
Absolutely. I mean, that's critical. Just the terminology that you mentioned to make it patient-friendly is important. Even things like gamification, providing some incentives to the patients to get them involved, get them actively looking at their medical information and providing information back to the provider. That's all part of our strategy and our plan going forward.
Really exciting. I mean, again, as I started out, to me, the interoperability, you mentioned, Scott, I think that you guys had been doing this for some time, but in a way it's been sort of the pure technology exchange, the technical ability to be able to do this. Now, all of a sudden, I don't think you guys were thinking about gamification 10 years ago.
No, that's right, absolutely. And so it is expanding. The scope of what we define interoperability is definitely expanding rapidly.
Now, one of the things that we were touching upon, and I interrupted and took us into the weeds, as we say, but we were talking about the challenges, and I think one of you guys were bringing up the challenge of even having people that have the capabilities and the knowledge to understand the technologies and the future we're talking about. I guess, Rob, kind of drifting into what I know you guys are really into, and that's this Interoperability University. Why don't you touch a little bit about that?
Yeah, we built out a program that we call InteropU. It's about a 6-week, pretty intense training targeted at new employees hired for Greenway's Interoperability Services Department. We start off with about a 2-week course for people that have zero knowledge of anything in the industry or interoperability. Bring those people up to speed, teach them things about like HL7 messaging, which is one of the standards used a lot in healthcare interoperability. And then after those 2 weeks, we bring in the more experienced people, so we can really kind of have a course that works with experienced resources and inexperienced resources. We'll teach them then the Greenway architecture and the Greenway tools, teach them about troubleshooting techniques and tips and things that we've learned over the years. It's a course that's a mixture of classroom instruction, some hands-on exercises, and even some mentor shadowing to provide a real-world spin on things that you just can't get in a classroom. So this has been built by people from the Interop group within Greenway, so they're really getting taught by the experts in the field with the real-world experience.
Might be an exaggeration looking at it from the outside looking in, but really you're not talking about a job opportunity or a training opportunity for a career path. You're talking about a talent, because I'm going to guess that ability is going to progress and grow as much as you guys are talking about expanding the concept. I guess where I'm going is that at some point, and I'm assuming now, cloud-based, everything is centralized. The way you distribute the technology is by individual institution or individual network. Because where I'm going is, those individuals you're training kind of become technicians, right, in terms of being able to service those situations as much as install them, or is it primarily the implementation?
Yeah, they do become the technicians. They do become the experts in the field. We teach them kind of the history of where interop has been in this industry, from messaging, the HL7 world, onto some of the newer technologies such as FHIR, which is one of the latest standards being proposed by the HL7 group. So really want to take them from early days where everybody built their own interfaces, there was no standardization at all, from messaging, and then on into like an API world, which is where the FHIR standard is headed.
You guys have been pushing the envelope for so many years that you think there's a joke about how can you be over the hill if you haven't reached the top. I'm trying to understand where Greenway ever stops, and it doesn't, because it's literally not only becoming more mature and sophisticated in the verticals that it's already been involved in for years, but literally creating an almost entire new verticals and supplying not only the technology but the education and training the way you're talking about it. I guess we're not quickly running out of time, but slowly running out of time. But just one question, we've kind of touched upon it in a couple of ways, but I always enjoy kind of putting a little bit of a challenge on when we get into a conversation like this, and that is we jokingly say everything is so 20 minutes ago. There isn't anything that you can't have change, because change means that at some point things were static enough to change. Now things are so, whatever it is, dynamically fluid, exponential. But can you predict the future of interop, and maybe go into a little bit about how companies might prepare for it? So I'll throw it out to both of you, Scott and Rob. Future of interoperability, and how do companies prepare for it?
Sure. Yeah. So this, Scott, I think that really what we're really seeing is 5-6 years ago, most practices maybe had 1 or 2 interfaces, which means that 1 or 2 setups of data exchange. Now what we're seeing is 4, 5, and 6 different types of interfaces set up. So there's a huge appetite for data exchange, and it's just growing exponentially. So what we're seeing is the focus is going from, as Rob mentioned, the setup on a lot of these interfaces can be time-consuming, and there's a lot of, even though there's standards, the implementations themselves are not always standardized. So what we're seeing is a shift towards making implementations faster, easier, and more standardized, and that way we can get more interfaces and more data exchange instances up and running. And Rob mentioned FHIR, which stands for Fast Healthcare Interoperability Resources, and that's a new HL7 standard, and it's really an API-based way to do interoperability with the goal of getting implementations up as quickly as possible, making it easy to do interoperability, and making it affordable for people to do data exchanges between systems. So that's really where we're seeing the future. And in fact, as you mentioned, the future is already here, and it's evolving rapidly. There's a lot of interest in the industry for FHIR and other similar type API approaches towards data exchange. And so it's clear to me that the idea, where it used to be that we want to exchange, we want to get our lab results, for example, now that's just going to be one of many different types of data exchanges that are going to be occurring between systems.
I can only begin to imagine, with all of the different things we see and hear, and when they all, hybrid is not even the right word, but they do hybrid upon each other. And I'm thinking, again, I was going to say probably it'd be interesting to talk to you guys in a year or two to see where things are going, but I think talking is, I'm dating myself, because I think it'll be more of a hologram coming into our studios and be able to communicate in some three-dimensional environment, and it'll all be projected from Greenway's interoperability platform. Well, listen, guys, it's always fascinating to get an opportunity to touch Greenway in so many different areas, a real opportunity to learn more about interop and what you guys are into. Thank you so much for taking time out of your busy schedule to join us for a few minutes today on Tech Talk.
Absolutely. Thanks, Frank.
Thank you, Frank. Appreciate it. Have a great day.